a closely watched meeting involving the CDC vaccine panel deciding whether to keep a 30-year recommendation to vaccinate newborns for hepatitis B. But as ABC's Jaclyn Lee reports, the decision has been delayed again.
A CDC advisory committee deciding to delay for a second time a vote on the hepatitis B vaccine. The panel meeting today to discuss whether it will change the recommendation that newborns receive the hepatitis B vaccine at birth, a recommendation that has been in place for 3 decades. The hepatitis B virus has no cure and can cause a serious liver infection for those infected. In children, it can be deadly.
And I don't think people realize how contagious this virus is. This virus is 50 to 100 times more contagious than AIDS. And I think people don't quite realize how at risk children are if they get infected early in life.
The panel planned to vote on this back in September. Today's delay comes after debate among committee members on voting language amid last-minute changes. Health Secretary Robert F. Kennedy Jr., a known vaccine skeptic, has questioned its effectiveness.
I say I'm not anti-vaccine. Saying I'm anti-vaccine is like saying I'm anti-medicine. Well, I'm pro-medicine, but I understand some medicines harm people. Some of them have risks. Some of them have benefits that outweigh those risks for certain populations, and the same is true with vaccines.
One of the CDC committee members has argued that unless the mother has hepatitis B, newborns don't need to be vaccinated right away. But many doctors have pushed back on this, pointing to data showing the hepatitis B vaccine is 90% effective when given to children within 24 hours of their birth. It prevents infections unknowingly passed from parent to child. Before this vaccine became common practice, nearly 20,000 children were infected with hepatitis B every year. After the vaccine, the number of infections dropped by 95%.
Most insurers are required to cover vaccines that the CDC committee endorses, making the decision on the Hep B vaccine that much more important for affordability and access. Jaclyn Lee, ABC News, Los Angeles.